You have to stabilize it. No. उसको नीचे कर.
Oh, okay. Actually, this way around. Let's see. Yes.
Yes. Ask me questions.
Regarding the brain mapping, any specific book you would advise me to read?
See, there are no such specific books by which you can understand what is brain mapping.
Yeah.
There are 2 types of brain mapping, 3 or 4 types of brain mapping we classify. But generally, this brain mapping is classified in neurosurgery. In neurosurgery, they do it while doing awake brain surgery, by which they map an area by brain navigation, in which they take out the tumor, right? In taking out the tumor, if they see that the patient is getting deficit, they stop their procedure there.
Yes.
So that part of brain mapping is different from this type of brain mapping.
Yes.
Because that is the invasive part of brain mapping in which a surgical procedure is done.
Yes.
And this is post-op brain mapping in which when the patient is stabilized, then the recovery procedure is done. Now here you provide a stimulus. The brain is a factory of whatever you want. Now you have to decide what you are looking for. The most important part, what you are looking for is the recovery of the brain. रूम में होगा
पता नहीं 3 रूम पे यहाँ पे है और होटल है ना वहाँ पे कुछ रूम में भी है बंदे जो भी आए हैं आज
301 में है ना कौन सा मैं एक बार पता करो मैडम से पूछो ना तुमको पता चलेगा
अगर आप एक रूम में पता चल गया ना तो बाकी को पता है कि कौन से रूम में है मेरे को पता नहीं अदरवाइज डॉक्टर किसी का नंबर नहीं है मेरे पास अनफॉर्चुनेटली
अरे तुम मैडम से पूछो ना मैडम का रूम अलॉट किया है ना हाँ so when you are speaking about brain mapping which we do
yes
this is a all typical type of brain mapping we do it we call it a type of a different type of stimulus which we provide now there are 2 types of stimulus which we have either we do it transcranial transmagnetic stimulation or transcranial electrical stimulation. The transcranial electrical stimulation is done by some electrodes by which you do some brain navigation, right? And then you approach an area to revive the brain. Yeah. It is done through the whole procedure is called neuroplasticity. The neuroplasticity is obtained by neurogenesis and angiogenesis. Neurogenesis is a process by which new neurons or the optimum neurons are there which take over the information from the other neuron and then the procedure restarts. Yes. Now, once the procedure restarts does not mean that the power has come to the limb and the patient has started walking. To train the brain again to rework with the group of muscles is another procedure which you have to understand.
Yes.
One is that obtaining the strength is one procedure and reviving the person to work again is a second procedure.
Yes. Yeah.
So there are a number of procedures which has to be classified. Number 1 procedure is whether the patient can walk. To make him to walk, first thing is you have to overcome 4 things. One is spasticity. Second is training of the area, bringing the power to the lower limbs, then coordinating all the group of muscles, then coordinating it with the eye,
yes,
then with the ears, then with the emotions, then you have to make the muscles learn. That is called cognitive learning of the muscles.
Yes.
And then making them what?
Work in coordination and start working.
Yeah, to bring them to a normal procedure.
Yes.
The whole procedure, which you call it, from 1 to 10, is called critical path method.
Right.
CPM. So from one task, which you start as the stimulus, reaching to the end task, is the walking. You have come across with 25 tasks or 30 tasks. They are classified into 4 parts. Start to start, start to finish, finish to start and finish to finish. So when you stimulus one part is started, simultaneously the working of, for example, you started working with the anterior part of the posterior muscle. So you stimulated here one needle. So immediately the posterior part also will start working. Then the middle fiber will start working. So it is called start to start.
Okay. Yeah.
But then there is a great tendon and the lower tendon, middle tendon, small tendon, greater and the lower tendon of the biceps muscles. So it does not mean when there is a subluxation, these two tendons will not be injured. There is an injury in these two tendons. So when there is an injury in these two tendons, what will happen?
The coordination is lost, the muscle power is lost.
Yes, the muscle power is lost and then the supination pronation is not achieved and the patient movement is totally wasted. You cannot see that the patient is able to move his hands, his leg. So basically when you are walking with a paralytic patient, it is not just to bring the power of the limbs but also to make the patient revive to his normal work, to bring fine movements. Now the problem is with us is that we think that the exercise bring the fine movements. It is not like that. Fine movements come from the cerebellum.
Yes.
Postural making and other things are coming from where? Cerebellum. So what was the pathway which you created from cerebellum to the motor area of the motor cortex? Now if you say divide the cerebellum into four parts, cerebrum, one is the frontal area, then the parietal lobe, parietal lobe, occipital and temporal. So frontal and parietal is divided by the central sulcus. Frontal, parietal and temporal is divided by the Sylvanian fissure.
Yes.
Right? And then comes the calcaneal fissure. We divide it from the occipital and the parietal lobe.
Lobes, yeah.
So now in calcaneal fissure you will see there are many various sulcus which helps you to coordinate with the eye movement. Now where do you walk? With the eye. Now this eye has a calculation of the distance you have to work. The eye has a calculation and experience and the memory that if you fall down in the ditch, what will happen? You will get an injury.
Yes.
But whenever there is a CVA, cerebrovascular accident, whenever there is a rupture in the injury, then this thing is lost. The calculation of the brain from the first step to the 24th step is what? Lost. So once it is lost, to revive back is called neuroplasticity.
Right. Okay.
So whatever you do, whatever action you have done, the end result is what? Neuroplastic changes in the brain.
Yeah.
It may be by the existing neurons also. It may be by creation of the new neurons also. But whatever be it,
It is neuroplasticity, yes.
it is neuroplasticity and the new neurons will take time over to take over the old neural changes.
Yes.
So whatever information which was stored in the old neurons which are now dead, have to surpass this information to the new generation of the neurons, which will take time to be trained. It is just like one CEO
Yes.
has died, another CEO has taken place. So over a period of time, he will be trained to work like the previous CEO or better than the CEO.
Yes. Yeah.
Or to bring to a normal functioning of the company. So if we take this, now if for example if we take company as an artificial person, so whenever there is a loss in the artificial person, what will happen? The CEO is lost, the entire functioning of the company is lost. Now when the functioning of the company is lost, either by the rupture or by the infarct or by the clot, this is done by three processes. One is by plaque of the carotid artery.
Yes. Yeah.
So this plaque when transferred to the brain, it becomes a stroke. Generally it becomes a MCA stroke. If you see the anatomy of the MCA stroke, it goes to the motor cortex area and the some part of the temporal lobe. Middle cerebral artery. Now middle cerebral artery, when enters to the frontal cortex, there is a homunculus which is from central sulcus to the precentral sulcus, which is Brodmann area, I think 3. Yeah, Brodmann area 3 or 4. So when you see this area is called homunculus. In homunculus, the execution of all the muscles are there.
Yes, yes. Even in acupuncture also they can reproduce the homunculus.
No, homunculus is not produced in acupuncture in no way.
Okay.
In Geosunfa acupuncture, which was first acupuncture technique, which was taken by a neurosurgeon, he said only one word, motor line.
Right.
So the motor line was taken. So he said 2/3 is the upper motor, lower motor line, 2/3 is the upper motor line, 1/3 is the voice area. So when you take a Geosunfa, you do not classify it with muscles. Motor line has nothing to do with muscles. Whether the hand is a group of muscles transferred by the nerve endings. They have a nerve supply. So nowhere in Geosunfa or Yamamoto the definition of spasticity was mentioned. So when the definition of spasticity was not mentioned, when the primary definitions are not mentioned, how can you overcome with the secondary definitions?
Right.
So when the primary definitions are not mentioned in medical books, that this is the process by which you can overcome paralysis, by this is the process by which you can do this. Now you are told to do passive exercise. Now the most difficult thing of passive exercise or any exercise, according to me, is a creation of spasticity.
Yes. There's no coordination and the muscles are already tight.
Yes, muscles are poorly coordinated because you do not work with the cerebellum. You do not work with the other areas of the brain. You do not work with the proper eye-brain coordination. So now they have taken out techniques like PNF, eye-brain coordination. They have taken out other coordinating methods. But it's just like keep training. Can there be any catalyst by which this process can be made faster? Because the question is that more you take time, the more you waste the life of the patient.
That's true.
Question is time is important, like justice late is justice denied. In this fact also, if you delay the life of the patient for a long time, then do you think the recovery of the patient will come fast?
No. It has to be done as soon as possible.
Yeah, you are right. We have to bring faster procedures for bringing the faster recovery. So to bring the faster recovery, you have to find out certain pathways, certain ways in which brain can be stimulated and brain can be revived and recovered and refunctional.
Yes.
But to make the brain refunctional, to create a neurogenesis, angiogenesis, what are the things required?
You need the stimulation, you need the right factors for it.
Yeah, there are two types of stimulations we provide. One is sensorium motor pathway and motor sensorium pathway. One is corticospinal pathway and one is corticobulbar pathway. So spinal pathway is a motor pathway, bulbar pathway is the sensory pathway. So sensorium develops the motor, motor develops the sensorium. So sensory information is provided to the motor cortex and accordingly motor cortex provides the motor output. Means for example your hands are burning in fire. The sensation goes to the brain of the burning sensation. So immediately the brain will say remove your hand and the instruction is then the brain is removed. Now in ruptured brain or damaged brain, this information is not processed. That my hands are burning and I have to remove my hands. This information is not
being transferred to the brain, yes.
Yeah, it's not transferred to the brain. So this information, since it is not transferred to the brain, what will happen?
You get injured because you're not removing your hand and the motor reflex is lost.
Yes. Now, brain has its own cognitive way of learning since childhood. These informations are stored in the frontal cortex and other areas of hippocampus, short memory, and the long memories, both are stored as experiences in the brain. Right? So this information when they are stored, so when required, these informations are surpassed to the motor cortex. Accordingly, motor cortex behaves. For example, this is cyanide. Once you know, you have never tested cyanide, but because the information is already there about cyanide in your brain, the first thing you will do is you will create all defensive position to avoid cyanide pushing in your mouth. You will apply certain force, right? So applying that certain force is the calculation of the brain on the basis of your experience. Again, this comes from the parasympathetic sympathetic pathway. Parasympathetic pathway explains about the fight, flight, and freeze motion of the.
Yeah. The sympathetic pathway is the fight, flight one,
And the parasympathetic says everything is cool down.
Yeah.
Now, imbalance of between these two is called the intentional tremor. Now, in this thing, when sympathetic pathway gets excited, and then adrenaline is released, it's a calculation developed in the brain either to fight, flight, or freeze. That is called an action and membrane potential of the
Yes. Yeah.
execution of the motor cortex. Now, that force is pre-calculated, whether you can work, whether you can defeat the army, whether you can help the people. All this depends on what? On your pre-calculation.
Pre-calculations, yeah.
Now, these pre-calculations are very carefully done by the brain. So, when you are working with the normal brain, you have all these experiences.
Yes.
But when you are working with the ruptured brain, you lose all these experiences.
Right.
So, when you lose all these experiences, what do you understand?
I mean, when you obviously lose all the experiences and you're at risk of developing injuries, all the things which you're going through.
No, you are in a position in which you cannot take your decisions. You become like a childlike person. So, to first is to revive everything. It's the emotional intelligence in the patient which has to be revived by the help of stimulating the needles.
Right.
It's called the emotional intelligence. So, whenever you stimulate these needles, they do not create neuroplasticity immediately.
Pathways to stimulate.
So, what do you mean by pathways?
No, this kind of stimulate the brain so that the neurogenesis.
What do you mean by stimulation?
The sensory pathways.
What is the stimulation?
You mean when you put in the needles at the right
Then what will
areas,
happen?
they stimulate the
What do you mean by stimulation? What is stimulation?
excitatory phase of, so that of that phase of group of neurons which you're trying to do in that area. Let's say you
Take out your mobile.
Yeah.
Take out the definition of stimulation.
encouragement of something to make it develop or become more active.
Yes. Stimulate means to encourage something.
Encourage.
So how to encourage the brain? Because brain is too busy with 1000 billion neurons. 100 billion neurons are there inside the brain which are full of activities. One part of the brain is dead. Now how will you stimulate? What do you mean by stimulation?
Encouraging.
How will you encourage?
You mentioned two methods. One is the uh, transcranial magnetic application.
Transcranial magnetic stimulation. Where is the study produced by which it can help a stroke patient to
There is no
recover?
studies. No.
That it can recover the deltoid muscle, it can recover the upper deltoid, middle deltoid.
No, there is no evidence now.
Huh? Which book, which research paper has mentioned that yes, this transmagnetic stimulations can revive muscle to muscle in the brain?
No, there is no.
Hmm?
I don't think there is any at all. I think the only option left is the one we're doing here.
You're right. There's nothing such type of books or things mentioned in which you can understand the basic factors of learning a procedure. Stimulation means what is the language of the brain? Can you tell me?
Yes, come in.
This basically. Sit down. Sit down. Very sit down. Be comfortable. Be comfortable. Sit down, beta. This room is like this only. One can sit there, one can sit here. You can sit comfortably like me. Open your shoes and comfortably sit. See, basically, what you see in medical science, we have the finest surgeries for all the department. But where is the finest recovery for the patient? Where are the tools developed for the recovery of the patient? You have developed the tools for neurosurgery is what? Neuromicroscope, which costs you 6.5 crores. Right? Neuroendoscope, brain navigation. Are you feeling cold?
No, sir.
You have developed brain navigation devices. You have developed functional MRI. You have developed 1.5 Tesla MRI to 3 Tesla MRIs. But what did you develop for the recovery of the brain? You are told that there is an infarct in this part of the brain. What do you mean by infarct?
The cells are dead because of loss of blood supply over there.
No, Swana Baljun. No. All these definitions are not included when you are speaking about all this. Writing something is not included here. You must know when you are speaking about brain, what is the language of brain? Speaking something what you like and speaking something you do. That means your concepts are not clear. If your concepts are not clear, then you do something and you will get something which you don't. You do something and you will get something which you don't want. You want to recover a patient of what? Paralysis, and you created spasticity by other procedures. Because you do not know what you are doing, since your basics are not clear. Fundamentals of what is stimulation? Stimulation is a passing of the signal in which a membrane potential is created in which calcium ion channels are released from where the sodium channels passes the sodium from the vesicles, it passes from the calcium channels to process the synaptic plasticity to the synapse to the other part of the neuron. there is a communication from one neuron to the other neuron, which takes place after optimum threshold. Optimum threshold means a proper threshold is given to the membrane of the neuron. Then the ion channels are open. If it is less, then also it is not possible. If it is high, then also it is not possible. It should be of what?
Is it 45 to
Optimum
70?
level. So when this optimum level, then there is a series of commands which controls isolated. First is the isolation of the muscle. First you have to understand the isolated muscle movement. Then isolated has to bring in a paralysis patient to the level of 4. If there is a spasticity, the spasticity has to be reduced and it has to be brought to the level of 4. So all the imbalance of muscles has to be brought and corrected to be the level of 4. Then comes the gate posture, that is coordination of the muscles. Now these 4 muscles which are discoordinated have to be reunited in one form to get the single unity of muscles which right now you are having. So that part is called what? Neuroplasticity of the what? Or neurocoordination of the muscles. Speaking something and understanding something and doing something is different. Just copy and paste from Google. Stop it. Some frequently, first page you will see, second page you will see. Did you ever study about the books and research papers which says about how things are done? I doubt. So to understand this, you must understand what is the language of the brain. Brain has 2 languages. What are they? What is the language of brain?
You mean
One is sensory and motor.
What is the language of brain?
neurotransmitter
Muscle.
What is the language of brain?
Coordination.
transmission of electrical impulses.
My Shri Dr. Aman Kapoor is coming to learn from me. We have hidden in the group. See, whenever you lose the spasticity, you lose one thing of the brain, you lose everything of the brain. The first thing is the emotions of the muscles. Now tell me what is the emotions of the muscles?
Placidity and spasticity.
Huh?
Placidity and spasticity.
What is the emotion of the muscle?
Contrast.
First of all, what is the language of the brain?
Generate electrical impulse.
What is the language of the brain? How do brain function?
Sir, nerve conduction,
When the efferent
electric
impulse goes ahead.
action potential, ऐसा
The language.
How many years you have worked on stroke patients?
yes sir,
How many years you have worked on stroke patients?
Stroke cerebral was
more than sir 10 years.
And you do not know what is the language of the brain. After 15 years of working with stroke patients, damaged brain, one simple question we do not know, and it is not you.
Yes.
The simple answer is electrical and chemical reaction.
Sir, after damage, if you give electric stimulation, then
What kind of electric stimulation you want to give?
sir, in physiotherapy we all only know sir, Faraday, galvanic.
Are there calculative electrical stimulations for the brain?
Muscles.
This is the only muscles.
So do you think this area of the brain which is having motor cortex damage, which has damaged the area, by putting signal in a damaged area, can you obtain anything?
No, no,
By spoiling relation with me, can you learn anything?
Never.
never,
Huh?
Never.
never, sir.
So you have spoiled the relationship with the muscles.
इसलिए सर रिजनरेशन नहीं हो रहा है.
Muscles to the brain.
Muscles to the brain. What regeneration you want in a dead area? Whether there is a hemorrhagic stroke or an infarct, what you want? What are you looking for?
Regenerate the brain. Regenerate.
Now how will you do?
To stimulate.
What? What stimulation?
Brain.
Where is stimulation?
Stimulating the brain.
Where will you stimulate the brain? How is the stimulator? Where is the stimulator?
इसलिए नहीं होता.
कहाँ है stimulator? You want to stimulate the brain. Where is the stimulator? You want to apply the tense machine. Where is the tense machine?
So you are the stimulator.
Forget about this. You want to say, I want to apply a tense machine. Where is the tense machine? Stimulation means you must know about the mapping of the brain.
Yes.
Now, what is brain mapping?
We do not know.
According to you, what it is?
According to sir.
I already put 10 by 0. Now you can speak anything.
Yes, sir. According to me, sir, it is there are several centers for different parts of the body. We have to know which part is responsible or which part are.
That is the Broadman area of which is already marked. Warnicki will speak, Broadman will speak for 22, 24 will speak 3, 4, 5 will do the motor functioning. Broadman has done this one in 1886. What you are saying, functional neuroanatomy, has been done in 1986.
Yes, sir.
1886 by Broadman.
It's continuing.
So what is brain mapping?
We should see I have.
What is brain mapping? वो क्या सीखना वो छोड़ो. What is brain mapping? You have done 15 years.
Brain mapping is नहीं जानते.
What is mapping?
To identify the
Marker.
areas.
Marking. मैपिंग कर
हाँ वही हम बोल रहा हूँ. What do you mean by mapping?
The area which is marked.
एरिया मार्किंग ऐसा
Identify the areas which has been destroyed or demographic changes being marked. That's generalized idea of mapping.
What is Google mapping?
Google mapping is
So search the areas which you want.
whatever you want to search, it
To map on the Google.
इससे इमेज सर टोटल जनरल
Acha, tell me what do you write in Google Maps? The location where you have to reach.
Yes.
In paralysis, what do you think?
Which areas?
First thing is to
Which part we want to
Which part of the brain has been damaged? Regenerate. And which you have to stimulate.
which part we want to activate
And
right, which part we want to activate. First thing is which part we want to activate. Now, how will you activate that part? And what is that part?
brain is the main
for example,
What you want to activate? Example.
the muscle.
muscle.
Which muscle?
Conducting muscle.
Conducting muscle. Which is conducting muscle?
Those which are paralyzed.
মোড়লাম কিরকম ছেলে পাচ্ছি 15 বছর পরে সালা কিছু জানি না। জুতা নিয়ে মার সালা দাঁত সাত ভাঙে দিয়ে বন্ধ কাকড় ছেলে তো 200 টাকা পিস পাচ্ছে এক কিছু জানি না খালি এক্সারসাইজ টেনশন non so भागे थी मौत को
सर मेरा एक्सपीरियंस बोलो सर
बोलो
सर 10 साल पहले जब हम लोग स्ट्रोक के एक्सरसाइज कर रहे थे तब रिजनरेशन थोड़ा ज्यादा होता था अभी ऐसा नहीं
तुम्हारा क्या रिजनरेट किया तुम किसको रिजनरेट किया मतलब
ब्रेन का रिजनरेशन नहीं है सर वो
तुम मसल किसको रिजनरेट किया है
ऐसा मैंने
क्या रिजनरेट किया है
पेशेंट का प्रोग्रेस होता था
पेशेंट का क्या प्रोग्रेस किया है प्लेसिड से स्पास्टिक लगे ऐसे करके फिर ऐसे ला दिया ये कोई प्रोग्रेस है प्लेसिड से लगे स्पास्टिक में पटक दिया you the patient was in placid stage and you made him acute spastic that is your progress
अभी सर कुछ पेशेंट में तो वो भी नहीं आ रहा
ये तो ठीक ही बोल रहे कुछ भी नहीं है
कुछ नहीं आ रहा है पड़ा हुआ है
इसीलिए
सबका सब पड़ा हुआ है 10 साल
बोलता है बहुत जगह कराया पे
यहाँ पे जो सरकार पेशेंट बोला
ऑलरेडी तो बोल रहा हूँ
कितनी जगह कराया
तुम्हारा पेशेंट ही तुम्हारे पास है
एक इनका भी पेशेंट था
तुम्हारा वो फिजियोथेरेपी से पीछे मेरे पास ही तो है एक महीना में देखो कितना डिवाइड हो गया
मैंने सर भेजा है मैं और सौरभ दोनों ने मिलके
किधर रगड़ा उसको
अच्छा तेरे से बस
हम आगे थे कहा ये क्या किया तुम लोग। सबसे पहला का बात तो ये निकला, व्हाट डिड यू डू? तब बोल एक्सरसाइज, वेरी गुड। व्हाट डिड यू अचीव? You gave this child as to me, the mother, and you taught her very good lessons. I think you should have opened one class for the physiotherapy class of the mothers. These mothers, they come and they are said very nicely, this steppages was not good, this was not good, that was not good. You have taught them very nicely physiotherapy. Said, by this cortisol will improve. Who taught you? At least you have done one thing. You have made all these ladies a very good physiotherapist.
Every mother.
Every
Every
month.
mother. We asked her to use around 5 to 6 times a day. You have to do it at your home 5 to 6 times. Muscle strength gained by mother. Mother's muscle power gained. But no.
Child, you lose the neck holding of the child, you destroy everything of the child. And I do no need, not a single physiotherapy exercise here for these children.
Yeah. She told me. Just only walking. Not
Walking? Not even walking. After 10 days, I made them to walk. I said, okay, you just bring needle. One needle after every 1 hour. Now you see that child. She is walking with what? Her neck holding you see. You are treated child, na? Her neck holding, are walking. I'll give you the walker tomorrow. The small child walker, na? She can walk. She can walk by catching one finger. And total neck holding, body posture, everything is very nicely ordered, very beautifully balanced. How could I do it in 10 to 15 days? And how many months did you take?
once. Yes.
हाँ ट्रीटेड हमारे हॉस्पिटल में दो तीन रिपीटेशन में आया था। एक बार 10-12 दिन से आया था और एक बार 10-15 दिन आया था।
उसके बाद तो सिखाया होगा उसको कुछ ना
एक्सरसाइज।
एक हाइपोक्सिक ब्रेन में क्या किया तुम लोग? What did you do in the hypoxic brain?
और सर नीडलिंग से हम लोग सीख पाएंगे?
I'm not asking what तुम सीख पाएगा तुम, हम तो ये पूछ रहा क्या किया। हम लोग को देखते हैं बात तो एक ही चीज समझ में आता है, वो केटामिन लेके सो जाओ। Take 2 ml of ketamine and sleep. See, brain mapping means you have to identify from where you will enter with the help of the signals and where the signals will go, so that the muscle power is immediately improved in minutes and seconds. Before that, you have to improve the neuropathic condition by local needling. What you have shown is the local needling by which I improved the neuropathic conditions. If you read the research papers, it is clearly written by continuous electrical stimulation on certain pathways, you will improve what? The neuropathic pathways. Once the neuropathic pathways are improved, then electrostimulation from the brain will generate those neurotransmitters by which the activation of the muscle and fasciculation of the muscles could be seen, which is called the contraction of muscles. By contraction of the muscles will start walking and he will immediately respond to what? Movement.
सर अगर पेस्टिक हो गया तो उसको पहले रिलीज करना पड़े.
Spasticity release cannot be done. Spasticity can be released only by brain stimulation because spasticity is in the brain, not in the muscles. The impact of spasticity, you see, is a symptom of the damage of the brain.
अपर मोटर न्यूरॉन रिलीज हो जाए.
Whether it is upper motor neuron or lower motor neuron, there is lesions in the brain by which the muscles get spastic.
इसीलिए अपर मोटर का रिजनरेशन नहीं होगा तो रिजिडिटी नहीं रिलीज होगा. इसीलिए
Regeneration का बात ही नहीं आता. There is nothing called regeneration here.
अच्छा.
The question is, whatever you have is enough. 100 billion neurons you have.
ओह.
We have already 100 billion neurons. You don't need 200 billion neurons again. And you don't need 150 billion neurons. You have only destroyed 1 million neurons or 2 million neurons. But destruction of that is destruction of the road. The interconnection of the neurons are destroyed. As a result, the action is not executed.
Means interconnecting means or spiral.
The connection, the one neuron is connected with the other, so this neuron is dead, so this the electrical impulse is stopped here. So when you do exercises, you generate these and that connections, which are not specific in nature. As a result, you create what? More lesions. And second thing is post-stroke complications. No, now question is not that post-stroke complication. This spasticity is another post-stroke complication. You should know brain is electrical and chemical reaction. So whenever there is electrical and chemical reaction, the heat of the brain is how much? 0.7 joules. It is very high electricity in the brain. Whenever there is electricity, there is a high heat in the brain. With this heat, you produce what? Chemical reactions. With this chemical reaction, there is a residue left. This residue is called what? Neuroproteins.
Neuroproteins accumulate हो जाते.
Yes, and they eat up the neurons. And then post-stroke Parkinson's, post-stroke Alzheimer's, all these are generated. Then CBGT is generated. Patient came with Parkinson, patient came with stroke, you gave him Parkinson.
इसलिए न्यूरो डॉक्टर्स ने वो पार्किंसन का ड्रग्स भी देते हैं एवरी पेशेंट.
यू राइट, हार्ट स्ट्रोक पेशेंट को 70% स्ट्रोक पेशेंट में सिंडोपा, कार्बिडोपा, लेवोडोपा या सिंडोपा दे देता है, बिकॉज बैक्लोफेन और सिंडोपा दे देता है बिकॉज पार्किंसन सिम्टम्स आर जनरेटेड नॉट बिकॉज ऑफ द ये एट्रोपी ऑफ द ब्रेन बट बिकॉज ऑफ द exercise you do, it develops atrophy of the brain. Damage. That is why I was angry with Anidya. That you don't understand the neuro concepts, and then you started criticizing the pain, this, that, and that, this environment. So I just decided. I was so angry with these people that I decided never to teach anyone from Bengal. But then, चलता रहेगा।
ठीक है, नीचे रखता हूँ।
आ जाइए रवि साहब,
आपका
नहीं रख दीजिए, अब भिजवा दीजिए।
ठीक है। I'll be there ground floor. आप यहीं पर रहेंगे ना?
मैं अभी यहीं पे रहेगा।
तो I'll send it across.
हाँ, थैंक यू सो मच।
अभी थोड़ा थोड़ा समझ में आ रहा है क्या गलती है।
Every paralysis patient is a neuropathic patient.
MND हो या
सारा न्यूरोपैथिक पेशेंट हो रहा है, MND and all this thing. That is why we have purchased EMG and CV machine. So tomorrow onwards you will see 7:30 to 9:30 the neurophysiologist will be coming and he will be observing after brain stimulation what is the condition of the patient. One peripheral neuropathy patient is there. You will see before and after studies. This patient was totally bedridden and he was unable to walk and use. Now he is able to walk with mild support in less than 1 month. He has developed post-stroke peripheral diabetic neuropathy. It is called mixed neuropathy. And he was having extreme burning sensation up to chest.
सर वो जो DMD जो केस है
Distance muscular dystrophy.
डिस्ट्रोफी वो कि इससे
हम रिवाइव किया ना, बच्चे को दिखाया ना।
आज देखा।
हाँ, गल इज वॉकिंग।
Very good result. Unbelievable. Divided, usually divided DMD patient.
Deteriorate. हाँ।
But it's
that गल इज वॉकिंग।
I've seen.
मैंने तो देखना ही छोड़ दिया है DMD।
हमारा तो शौक है DMD।
चार पांच पेशेंट देखा है तो क्लिनिक में अभी इम्प्रूवमेंट नहीं आ रहा है तो छोड़ दिया, अभी नहीं देखते।
ये सब देखा करो तभी तो तू हमको भेजेगा।
नहीं सर, सर मेरे लिए सर
Actually,
वो
we can't do anything with
पेशेंट रिकवरी जरूरत है। मैं देखो और जिधर भी सर जहाँ भी भेजना चाहिए।
तुम लोग जिन पेशेंट को देखा है, कल तुम देखिएगा एक एक पेशेंट को, how I revive them. I did not do any brain stimulation very beautifully because my team is also like you. I don't want to talk to my physiotherapist. They've already annoyed me. Because these are freshers. They are in seventh sky. It is better not to talk to them. Thank you so much, sir. Give it to me. Give it to me. थैंक यू, थैंक यू सो मच। अब किसी के थ्रू भिजवा देते हैं,
ऐसा
किसी के थ्रू भिजवा देते हैं। थैंक यू सो
तो हम
मच।
लोग चले जाना, है ना? टेक केयर।
स्टेम सेल थेरेपी हो गया सर,
वही देखा था नीचे
6 7
लोगों का
वी हैव क्रॉस्ड द फिगर ऑफ 100 in 2 months।
ये महीने में।
हाँ, मून में वो भी।
ओके सर,
थैंक यू। We have developed the cheapest stem cell therapy, best stem cell therapy, and we have crossed more than 100 procedures within 2 months.
ये सब पेशेंट के लिए आप सर भगवान। पेशेंट के लिए सब पेशेंट का वो जो दर्द है ना वो मतलब सह नहीं जाता। और डीएमडी पेशेंट, एमएनडी पेशेंट हो
अलग तो हमको अच्छा लगता है। स्पाइनल कॉर्ड इंजुरी, ये सब में तो काम करना है।
I've seen one patient.
And that Kolkata patient,
Yeah.
day after tomorrow you will see him walking also.
वो पेशेंट हो
उसका एफओ लाया नहीं, they did not bring the एफओ of that patient. Otherwise this spinal cord injury patient will also walk.
He was saying he can move the hand.
Yes, his hands and limbs, upper limb is moving now. He's quadriplegic, cervical cord injuries. Cervical cord, quadriplegic. Now you see he's moving, he's independently sitting. Another patient from Somalia, severe canal stenosis. I think you have seen the MRI also now.
Yeah.
Vertebral fracture,
L3,
L3, L4, with gunshot injury. 2004. Somalia. American doctor refused to operate that patient. Delhi doctor refused to operate. No one was willing to take this case. The best acupuncturist of India, Padma Shri.
This time you will be teaching us Tung, right?
Tung I already taught in the online class.
Actually, we could not attend.
The videos were there, you could have.
अटेंड क्यों क्लास, लेकिन वो वीडियो से ठीक ठाक से नहीं समझ नहीं आता, तो इसीलिए
देखो, now the question is that, first of all, you try to understand things in 1 class or 2 class or 3 class. Is it possible?
नहीं।
Did you understand physiotherapy in 3 classes?
वो सर जो टूंग का जो प्रिंसिपल है वो ब्रेन में
ये बहुत अच्छा है, तुमको मोटर पॉइंट बना के काम करके ब्रेन का न्यूरोप्लास्टिसिटी क्रिएट किया है.
अच्छा
It was the only acupuncture we spoke about reaction nerve and the reaction area. Small area recovers the bigger areas.
टूंग एरिया को लेके ब्रेन तक सिग्नल पहुंचा सकते
Neuroplasticity क्या बोला ना?
न्यूरोप्लास्टिसिटी उसमें नहीं आता है.
नहीं
रिएक्शन एरिया रिएक्शन नर्व आता है. न्यूरोप्लास्टिसिटी कब आता है? When you are taking definition of neuroplasticity, it's just like driving a car. You have learned to drive a car. Now once you learn to drive a car, you don't need to put concentration on driving car. Your hand and eyes are automatically doing the car driving. You understood?
अच्छा ऐसे ऑटोमेटिक अभ्यास
ऑटोमेटिक अभ्यास हो जाता है. So the problem with you is that you up to now you did not work with the recovery of the patient. You worked with something about which you also do not know what you did.
Yes.
You just followed the traditional concepts without thinking what is happening.
फिजियोथेरेपी में वही
Last time I was very annoyed with some of your people who came from Calcutta. Later on I came to know they are from sports physiotherapy. If I knew they are totally from sports, I would have practically said them, it's no use of coming to me. Because without seeing an MRI, without seeing an X-ray, let us suppose this is the disc which is intact, right? This is a disc which is intact, right? Now it has been prolapsed. There is a pain. Now you do chiropractic like this. What will happen?
ज्यादा रिलैक्स
ज्यादा रिलैप्स होने के बाद क्या होगा? एक्सट्रूशन हुआ या और प्रोट्रूशन हुआ, जाके क्या करेगा? व्हाट विल हैपन टू इट? कैनल स्टेनोसिस. Canal stenosis will lead to myelopathy. Myelopathy will lead to quadriplegia or paraplegia. Are you working with the pain or are you working with the symptom of the pain? You're not even working with the symptom of the pain. What is pain?
caused by actual or potential damage to the tissue.
Huh?
It's a
inflammatory sign.
no. It's a emotion, and usually emotion is caused by actual or potential damage of the tissue.
Pain is a symptom. And it remains as a symptom until it is diagnosed. But when it is diagnosed, it becomes a part of the disease. So you are treating a symptom without knowing what is a disease. What will happen?
बीमारी रह जाएगी.
Treatment will be useless.
Treatment? You came with one disease, I gave you 3 diseases.
There will be secondary.
What secondary? Primary, more primary complication.
प्राइमरी कॉम्प्लिकेशन ज्यादा हो
That will
जाएगा
develop to
और
a
सेकेंडरी
प्राइमरी कॉम्प्लिकेशन था पैरालिसिस. तुम उसको चला किए वास्कुलर नेक्रोसिस कर दिया तो वो प्राइमरी हुआ ना सेकेंडरी हो गया.
प्राइमरी.
Now because of the pain the patient cannot walk. तुम बताओ, तुम्हारा कॉन्सेप्ट गलत है ना हमारा कॉन्सेप्ट गलत है? लॉजिकली बताओ।
हम लोग का ही करूँ। इसीलिए तो इम्प्रूवमेंट नहीं आ रहा।
इम्प्रूवमेंट कहाँ, तुम तो प्रॉब्लम क्रिएट करके दे रहे हैं। तुम आज फ्रेंड का जो पेशेंट आया था, द वन whom you have referred, without even seeing anything of the patient, the moment the patient came, I said C4, C5, C5, C6, C6, C7, there is a nerve compression, C5, C6, there is a large disc compression, whereas C6, 7 also has a canal stenosis of the people with annular fissure at C7, C8 or C6, C7 might have a fissure. He referred one patient through his friend.
No, it's my father-in-law actually. He's my father-in-law.
Ah.
Yeah.
Right? I did not even see MRI. He just told me two finger flickering like this, and I gave my diagnosis. Then I said, "You bring your MRI. Let me see if I am right or wrong." The moment they brought the MRI, I said, "Read out the MRI and see if I am right or wrong." And today, if you see, it was continuous flickering. Now there is no flicker in these two fingers.
Yes, I saw that today. Yeah.
वो सर फ्लिकरिंग क्या
It was because of nerve irritation, nerve root irritation.
हाँ इरिटेशन के लिए
इरिटेशन के कारण वो बार बार कंप्रेस वो इरिटेट हो रहा था, इसलिए इम्पिच होने के कारण वो बार बार ये कंप्रेस होते हुए बार बार ये मसल को फ्लिकर कर रहा था. I revived it from the roots. Now patient is okay. Otherwise, it's a case of neurosurgery. Within 3 sessions, I revived, I think.
Yeah. 3 sessions.
Yeah.
3 or 4. Yeah.
First session, I just gave a demo. Recently, 2 or 3 I gave him. And patient is revived by 70%. So chiropractic is only done for musculoskeletal problems, not for any pathogenic reason. But since you do not know what to do with the patient, you found the easiest way to revive is chiropractic adjustment. Now tell me, by chiropractic adjustment, can you do any recovery in the disc lesion?
नहीं सर
Osteophytes, OPLL?
contraindicated.
You are right, contraindicated. And what are you doing?
ये IVD contraindicated.
You are right, it is contraindicated.
और YouTube में ज़्यादा चलते हैं वो chiropractic.
यूट्यूब में भी अभी फैशन हो गया
YouTube में पैसा नहीं और
No, see, question is not. See, one thing I tell you, people are not fools. You destroy your case, and you are in what?
जी
Right. People won't come.
Check and mate. I'm not against any pathy or chiropractic or osteopathy, but my question is it correct?
इन सर न्यूरो के सर इट इज contraindicated. PID.
In neuropathic cases.
Neuropathic.
So where are you using? In all neuropathic
Yeah.
cases you are using it.
I have seen in YouTube some guy using chiropractic treatment on CP child. हाँ
फिटनेस का
एक chiropractor
तुम्हारा तो दोस्त लोग भी करता है बेटा करो কোথায় আছেন
सर आप लाइव है
হ্যাঁ মনে দাও 18 ইয়ার বেটাই কোথায় আছেন without seeing the x-ray এরকম ব্যথা তো কিরকম ভালো কালকে কিরকম থাকবো আমি জানি না পেশেন্টটা তো রিকভার হয়ে গেছে স্যার আমি জানি তো পেন তো কমছে তার দিকে এমআরআই তো করছেন প্রবলেমটা কি আমি জানি না ওপিএলএল হতে পারে অস্টিওফাইট ইম্পিঞ্জমেন্ট হতে পারে
Yes, sir.
After seeing some of your videos, I only say it is my bad luck that I have taught some students. Subham was better than all of them. Subham Bakshi.
पार्किंसन का जब
हम ही सिखाया था उसको
हाँ हाँ वो लिखा है उधर आपका नाम
आज भी देखो शुभम ऑस्टियोआर्थराइटिस का कितना अच्छा रिकवरी किया है
आज के आज
हाँ वीडियो देखा है माय आईज ऑन व्हाटएवर यू डू
ओ
एक सेकंड में पहचान जाता तुम क्या किया है The results you bring also tells me what was the question and what was the answer you gave. And who was the examiner? See, anything what you do must have a root. ROUTE, root. For is redevelopment, regeneration, activity by which the obstacles are cleared and the path is opened and you reach your destination.
ड्यूटी क्लियर ना हो तो जाएंगे कैसे
रास्ता ही नहीं बना
रास्ता ही नहीं हुआ तो नहीं
This is the reason why I don't like to teach non-medicos.
Yes, sir.
Yeah.
Yes, sir. Right, sir.
If medicos, the position of medicos are like this, then what will be of non-medicos?
Right.
Huh?
Yes, sir.
Better to commit suicide than to teach them. The moment he says I'm BA pass Andulan acupuncture, I said, where is my thread where I can hang my neck? When this is your position, what will be their position?
Right.
Yes, sir.
One who has read 15 years has done. If this is your position now,
Yes, sir.
what will be their position? Hmm?
विदाउट नॉलेज सर पहले उन लोगों को सर इजी लगेगा
हाँ,
विदाउट नॉलेज
Right, right.
विद नॉलेज सर डिफिकल्ट लगेगा
अब देखेगा अरे क्या करूँगा मैं
एकदम सही बोला. बट जब रियल नॉलेज आ जाता ना बेटा, when you have the real knowledge of the subject,
यस सर
you find all the subject to be much more easier
यस
and lighter.
यस
Because you never wanted to develop what your clinic, so your fee cement is 200 rupees. In the most rural part of my Assam also, in Assam also I used to earn around 30 to 40 L. Per day my income was not less than 1.5 L. Here also equal, without advertisement.
यस
I think you have seen today how much patience I have.
So before you said this was only started 2 months ago.
Ah.
So where were you based before then?
In Sapphire building there were not much patients because there was lot of building tension. But here after I have shifted, you can see how much patience I have.
So this whole building is your main
Yeah,
hospital?
this is, we are the tenant of this building. Already I have typed a message in the morning that we are buying 128 slice city. We have already purchased EMG and CB test.
वो जो सर मॉनिटरिंग होता है वो क्या जरूरी है वो एनआईबीएस के लिए
I'm actually care, I just want to see whether there is any fluctuation in the vitals or not.
यस
Otherwise it is not required. This is my own study. कि पेशेंट कहीं एंशियस हो गया, कहीं बीपी, because these are stroke patients ना.
यस सर
Sometimes they become very anxious. The BP may fluctuate to 180, 200. We have seen during the procedure, the BP has gone to 200.
यस सर
But generally what I do, I have purchased around 15 paramonitors.
यस
Even after doing stem cells, we put these paramonitors.
सेको होगा सर ट्रीटमेंट करने से
I always try to obtain a safest path.
यस
For example, there was a perfusion in a patient who was here. We have put the cardiac monitor and all. The moment we saw he was sinking cardiologically, right? His respiratory rate was going down. Immediately we were informed, we bought the ambulance and we shifted to the ICU,
यस
right? Early yesterday up to night he was okay. I visited him, right? Fully oriented and but patient can sing any moment.
यस न्यूरोलॉजिकल केस
Not only neurological, any patient can sing any. So always better what?
Better to be safe than sorry.
Yes. We have made ECG free for all the patients. I'm going to put CT scan free for all the patients.
यस
EMG, NCV test free for all the patients. Why research was not been able to done? Because the cost was pushed either by sponsored by an pharma company or pushed by the hospital. So you cannot do reinvestigations, you cannot do these things, right? Only after a certain limit you can do. Here we have our own equipments, own devices, so we can do as many times as we want.
और मेरी जरूरत में जब कभी भी कर सकता हूँ।
हाँ, न्यूरोफिजियोलॉजी टेक्नीशियन है, अब 5 दिन बुलाया उसको, ऐसे वो 3 दिन आता था मैं, about in 5 days, so that morning evening you can see the morning patients whom we have treated. Next day you can see what are the neurofunctional changes, NCS changes in the patient.
आपका थॉट्स बहुत अच्छा है।
नॉलेज है कंसेप्ट डिवाइस किया है।
मैं ये वो सब मशीन एक साथ के नहीं किया, ये कॉन्सेप्ट बहुत है फॉर द
हम तो कलकत्ता से भी सस्ता ट्रीटमेंट करता है, यहाँ 1500 रुपया ट्रीटमेंट का, 1500 रूम रेंट का, 200 नर्सिंग का। बताओ तुम लोग कर सकता है कलकत्ता में, जिसमें RMO भी है, DMO भी है, 4 बार एक्यूपंक्चर भी होता है, 2 बार ब्रेन स्टिमुलेशन होता है, ECG है, नेसेसरी मेडिसिन फ्री है, 2 कंसल्टेंट्स आता है, एक कार्डियक एनेस्थेसियोलॉजिस्ट है, एक मेडिसिन डॉक्टर है, 24 आवर्स हमारा ड्यूटी है। तुम क्या 1500 रुपये में ये फैसिलिटीज दे सकता बंगाल में? हाँ, कोई हॉस्पिटल कोई सेंटर में दे सकता है? 1500 रुपये में इतना बढ़िया रूम दे सकता है?
सारे रूम ऐसे ही है।
बेटर देन मी। बाकी में तो मेडिकल बेड भी है। फ्री एम्बुलेंस, that is why I said brain stimulation, nerve stimulation, all these are the important parts of recovery. But then the people who came to me, they did not wanted to learn how to revive the brain. Shiva Monday wrote me, sir, I am mid of the ocean. I am in mid of the ocean. I said, who told you to go in the mid? When I was teaching you, what you want to create, you must have proper infrastructure. Tomorrow if I have to prove that acupuncture and the neurogenic pathways are different, then this can be proved only by 2 things. One NCB machine and the meridian charts.
उसको 104 लाख को सीजनिंग आ रहा है, तो क्या करें? हाइड्रोकोर्टिसोन
कौन सा है डोज?
वो नहीं करता है बच्चा।
उसको क्या हाइड्रोकोर्टिसोन मत दो, उसको सिरप दो। लास्ट टाइम भी हुआ था, 20 मिनट के बाद अपने आप ठीक हो गया। वो पैरासीटामोल सस्पेंशन,
वो इससे बोले कि पैरासीटामोल सिरप वगैरह तो
पैरासीटामोल सस्पेंशन दो, वेट एंड वॉच, ठीक है? लास्ट टाइम भी 20 मिनट के बाद ठीक हो गया था। So there are many things which you have to understand when you have to recover the patient. One is neuroinflammation, one is food, one is brain stimulation, one is tapering of the drugs. Most important drawback in Bengali alpha is the UTI infection.
So recently,
Water.
what?
Hyderabad and Bengal is having one of the highest UTI infections. Panoram, Manoram, all these antibiotics they destroy both good and bad bacteria. As a result, nutrition of the food is damaged. As a result, the food does not get nutrition. Patient again sinks. Basically, I wanted to teach you all types of brain stimulation, but then last time I had a very bad experience, especially with your friends. So then I decided this time I will not teach much on brain stimulation because people think that I am insisting of buying on these devices. I say my one patient what pays to the institute is entire of his seminar fees.
Yes.
More than that.
Yes, sir. फीस तो नहीं है सर.
ये तो तुम लोग का खाली खाने का खर्चा है.
हाँ, right.
Right.
तुम लोग ये सब सेमिनार को वो सब सेमिनार के साथ कंपेयर करता है जो तुम लोग का बरदान है लोग का सेमिनार के साथ कंपेयर करता है बिकॉज दे डोंट टीच यू ऑन पेशेंस.
Yes, sir. मॉडल के ऊपर.
हम लोग यहाँ तो मॉडल ही नहीं है, यहाँ तो डायरेक्ट पेशेंट से बात करो.
Yes.
You are the patient. Yes.
They are हाँ. मॉडल के
Yeah.
ऊपर.
Actually,
मैं तो मेरे पास चारों फिजियो है, बात करो चारों फिजियो से. वो लोग क्या सिखाता है तुमको पूछो, उनको क्या आता है पूछो. थोड़ा उनको भी थोड़ा लगा के जाओ तुम लोग. हमको कम से कम तुम लोग उसको कुछ लेसन देख के जाओ. हम तो नहीं सका. हमारे काम करके तो जाओ.
right.
हमारे साथ थोड़ा कोऑपरेट कर, उतना लाइक तो उन लोग को बना के जाओ.
Yeah. I asked one of them, is some teach us some lesson. हम क्या सिखाए? ये भी तो ज्वाइन की, आपको सीखना बाकी.
तो तुम लोग तो उन लोग को थोड़ा सा ताकि थोड़ा हमको कोऑपरेट करे. तुम लोग थोड़ा सा दे के जाओ लोग को, थोड़ा मिर्ची लगा के जाओ. हाँ 15-15 साल है तुम उससे कम से कम डरेगा तो सही. थोड़ा सा मिर्ची लगा के जाओ, तुम मिर्ची लगा के जाओ. तुम लोग ये कम से कम ये लोग हमको पेशेंट ट्रीट करते वक्त हमने साथ थोड़ा कोऑपरेट तो करेगा. हम तो ये लोग अपना रूम में भी घुसने नहीं देता. I'm so annoyed. For 30 years, I never worked with physiotherapy. Physiotherapy work was very less in my work. I kept physiotherapist only to keep the patient busy. For 30 years of my life, this is the only part of my life where I'm working with physiotherapists and I'm really tired of them. एक रात को 2 बजे भाग जाता है.
वो फिजियोथेरेपिस्ट सर जिसके बोल रहे थे और एक सुबह
हाँ, एक वो तुम्हारा बंगाली भाग गया 6 बजे.
घर किधर है?
एक बंगाल का था और एक यहाँ लोकल था. बोला सर, आई एम सो डिप्रेस्ड that I do not know what I have learned and what I am practicing is correct. So out of depression I am living it. तो वो बोला सर वापस आना चाहता है. बोला वापस आके अब क्या करेगा? You are already depressed. Finding a mistake and correcting it is not a wrong job, my brother. But repeatedly doing the same mistake is what?
Crime.
Crime. You see, I studied all the research papers of stem cells. We took 5 days, day and night I studied with the orthopedic surgeon who came from Mumbai. And we took out one procedure, right? And this procedure was one of the simplest procedures and the cheapest procedure of India. And the best procedure. And every patient improved. You randomly go in any of my rooms and ask, what is the outcome?
This is the same we are improving.
Every person is saying.
And there is not a single advertisement we made.
patients itself are the advertisement.
Hmm?
Patients itself are the
Yeah,
themselves
yeah.
the advertisement.
Right.
We don't get time. So I'll teach you some neural blocks and all.